Thank you all so much for attending today's info session. The topic is research at CHSU-COM. Before we get started, I want to give a brief disclaimer about consent to be recorded. So this info session is being recorded, so by remaining on the info session, you consent to being recorded. I'm going to go ahead and provide a brief introduction to our presenters today. So our first presenter is Dr. Edward Merino. He is the Assistant Dean of Research here at CHSU-COM, and he is also a professor of biomedical education. And then our second presenter today is Maria Torres. Maria is a registered dietitian nutritionist, as well as an adjunct instructor here at the COM. So without further ado, Dr. Merino and Maria, I will go ahead and turn it over to you.
Hello, everybody. Hope you guys are doing well. Hopefully you guys can see my screen and we can talk. The structure of today's conversation or town hall is we're going to give you a brief overview of a couple different things. First are kind of in the general idea of how research happens here at CHSU-COM. And the second thing is going to be an introduction to PRHS class, which Ms. Torres will give after me. We'll then have about 10, 15 or so minutes to field any questions you have in the college or CHSU regarding research, okay? Hold on, okay, there we go. So I wanted to first talk to you guys a little bit about how research is done at CHSU. There's basically three major components. First, all of you guys, if you guys attend this school, will be enrolled in a class that's called Physician's Role in the Health Systems. That class is a didactic course and it goes every semester for the first 2 years. So there's 4 courses. And you're going to learn a little bit more about that on the back end, but there you're going to learn the basics of research, health system science, public health, and biostatistics. These are all items that are in the COMLEX Level 1, which is your board exam. And the other part of that class is as a team, you're going to work in a group on a research project in community clinics to kind of accomplish a project and utilize these pieces of information that you learned here or have learned previously in order to complete the project. Now, that's not the only research that occurs at CHSU. There's a whole nother kind of avenue of research, which is usually either faculty-led or student-led. And there are 2 principal components there in the year 1 and 2. So in your undergrad medical years, you may do foundational research or you may do your own community and clinical-based projects. Usually you'll be paired with the faculty member or some outside entity, and that's how we'll kind of interact with you. And then in years 3 and 4, the predominant mode of research is going to be clinical case reports and other clinical projects at your rotation sites. We have kind of a large research day here. Last year we had like 120 posters done. Mostly about 75 of them, 80 of them were by students, and the other ones were kind of outside groups in the local Central Valley coming on campus. And we also have a lot of publications, which we'll talk about in a little bit. Here's a brief intro to our research program.
I'm Peter Thierry. I'm president of SBA.
Hi, I'm Felisa Hong. I'm a second-year medical student, and I am the research committee chair.
Student Government Association is here to help you all as students find opportunities to work outside of the classroom.
Doing research is so cool in terms of learning more about fields that you're interested in. You can do a deeper dive. You really satisfy that scientific curiosity that you have.
So here at CHSU, we have lots of learning opportunities and opportunities to get involved in research. We have great faculty and staff that are ready to help you all get into either literature research, lab-based research, or clinical-based research.
CHSU Research Day is a day where we gather students, residents from the area, and we come together to share each other's research. We're going to have posters, we're going to have presentations, a guest speaker, and just really a chance for everyone to showcase all the hard work that they've done.
Even if you don't have research, Research Day can be a great opportunity to network with new physicians that are coming to the area, as well as to support your fellow students in their own research. My own personal research journey here has helped me get in contact with the librarians. They've been able to connect me with mentors, hone in my craft of writing research papers, doing a literature review, and understanding the importance of every step of the research process.
Learning about the research aspect of medicine is something that you don't really do in the classroom. It's been so great seeing all of our CHSU students kind of blossom from some students who have had zero experience in research, and seeing them come out with a project is so rewarding.
All right. So you can see that there's a variety of research projects that we do here. Oh, there we go. And so one of the things I did is I took all the projects that people do, and I had the computer or the AI make a word cloud so you can kind of understand like how we do research here at CHSU. And you can see, for example, our biggest word in the word cloud, which means the most number of projects devoted to it, was diabetes research. You have some neurology type research. Last year, a big emphasis was on the gut-brain axis. We do a lot of pharmacology, especially reviews and systemic reviews. You can see PRHS is cropping up in here with public health. And you can see it a couple times at community-based projects. We also do some medical education research. We quantify screening at different clinics. So there's actually a whole host. We also have a laboratory that we do research at. There's 3 groups working there, and I'll talk to you about that in a couple slides from now. And a lot of students also work off-site with other sites to do, like, for example, local physicians who want to do projects. So by the numbers, we're pretty small on average, but you can see we're publishing 44 peer-reviewed manuscripts from the last year. 97% of these manuscripts had a CHSU student on them. Most of them have many students. So you can see that there's a large opportunity kind of to publish. Most students, when they publish, will publish in their second year or third year. That's where the majority of them publish. The papers are mixed between, a strong majority of them being with the CHSU faculty member and students. The remaining ones tend to be with preceptors. So those tends to be the third years and fourth years doing case reports and other clinically related research projects. In the last year, we awarded 50 student travel awards. So we sent 50 students, mostly in different cities in California, to present their research findings at different conferences. Some were oral presentations, but the majority of them are posters. We have had students, for example, travel to national conferences like ACOM, National Pathology Association, and these ones. And every year, several of our students win some sort of research award. We view research as one of our strengths here at CHSU. We have a laboratory space, and we have 3 teams currently working. One team is sampling fungus in the air. This fungus, when construction occurs, it's dug up and gets aerosolized and gets people a disease called valley fever. We also another researcher is looking at how plastics interact and cause endocrine cancer. Anything that's very hydrophobic is called an estrogen receptor mimic. And so if you have a exocrine tumor, which is hormonal tumor, it can be turned on by anything that's like an estrogen receptor. And there are a couple teams working on inhibitors of enzymes. We currently have our own IRB and student research committee. So we have a lot of opportunities both for you to do research or do kind of leadership organizational positions. For example, the student research committee works on research day. Last research day, we had 150 posters, as I talked about. We had over 300 attendees, both internally and externally. I wanted to show you a couple manuscripts so you can see the kind of stuff that's going on here. You can see this is Dr. Ibarra, who's a pharmacologist locally and works with us, and he likes to work with a lot of students. And he wanted to do the optimal glucose reduction in diabetic emergencies. And so he worked with these students to do electronic medical record search and try to figure out how much glucose reduction by giving insulin to these patients is necessary. And here's another example. This is a review article by Dr. Peminati. And what you can see is he's exploring the therapeutic potential of ketamine. I know ketamine is going to become FDA approved soon for PTSD. And there's a strong interest in understanding it. So he did a literature review on these. And as I discussed, we had about 44 papers last year. We average around that area most years. We do have other programs I want you to be aware of. We have a summer research program where you're hired by the university basically, and you work with a faculty member for 6 weeks in the summer to do research, whatever their research projects. And you can see here, I listed some of their research projects. So for example, here, this is a medical education study looking at how to learn anatomy. Here's a review on the GLPs, which are the kind of Ozempics of the world. Here's a scoping review on the effect of knee injuries on females when they're fatigued during sports. So there's a whole host. Here's diabetic research. And here is health insurance type utilization type research. So depending on your background, because we have diverse backgrounds of students, at least educationally, they'll have all kinds of different projects. And here's this lab-based project here. And again, we have also a student government research committee that works with the faculty research committee to host research day and do other student initiatives like town halls and educational series. With that, I'm going to hand it off to Ms. Torres.
Thank you, Dr. Merino. So I'll be talking a little bit more about PRHS. And so PRHS kind of has a few parts to it. The first part is you see there, that image is when you're in class and you are learning about biostats, you're learning about different research methods. And again, all of that information that you're learning will help you prepare for your board exam, but also help you prepare for the project that you're going to be working with the faculty member and a site in the Central Valley. So these clinics could be like Omni Health, they can be United Health Centers, Cameron Health, a lot of different clinics in the Central Valley, which gives you an exposure to the different clinics. And, you know, you might even end up liking that place and wanting to work there in the future. And then if you can move on to the next slide. So this is an overview of how PRHS works. So during your first 2 years at CHSU, you'll be taking the PRHS courses. So the first semester, again, you're going to be learning about the background, so biostats, epidemiology, health system science, which if you didn't know, it's basically integrating biomed science and clinical science, and it's basically to improve outcomes and clinical costs of the healthcare system. So you learn that, and then during spring semester, which is your second semester as a first-year student, is where you are then going to start to meet the site where you're going to work at, and then you're going to work on research methods. You're going to implement the research method. You're going to find materials, methods, surveys, that study design, which is where we are at currently right now. So I'm working with a few groups. We just met with our site, and now we are going to start to prepare, because when you come in during your second year, which is the fall semester, is where you're going to start to collect your data. So you're going to go to the site, you're going to collect your data, and then you're going to analyze the data. So that way, when you go into spring semester of your second year is where you are going to start to prepare to present your research. Which it will be at Research Day, but that doesn't limit it to that, to CHSU. You can present your poster at different sites. I've had several students present all over California. And again, that's going to help you prepare for your board exams. So we can go to the next slide. So different projects. This is just an example of some. It can be finding barriers to care. I've done a few research projects, finding barriers to diabetes management. Some of them include surveys when, again, you're going to either create the survey or you're going to find validated surveys to be used for your project, quality improvement, analyzing EMR systems. So many different projects there. It's not limited. And again, it's with different clinics. And so then if we can go to the next slide. So this is an example here. This was a project that I worked on. And this is basically what the posters will look like. So you are going to work with the team to create this poster. You can include the information that was involved in the project. You're going to include your methods, results. Due to time, I'm just briefly going to go over it. So basically, this was just looking at the standard determinants of health and trying to implement a survey, which is that prepare tool, to patients to kind of figure out what are their barriers for them to getting proper diabetes management care. And so you see there, we implemented the survey and then we found that some of the workers just weren't using it. So how to teach the workers to be able to use this tool so that way patients can get the proper care. And so if you go to the next slide, the poster is pretty similar. So it's at Golden Valley Health, where we're looking at barriers to comprehensive diabetes care. What they found there is that the biggest gap to managing their disease is food costs. So now we go to Golden Valley Health, we're like, hey, patients, they're thinking that food costs is their biggest barrier. So how can we help them? Should we help them apply for CalFresh? Different things like that. So you see, we're making a really big impact in the community. And if you go to the next slide, this is an example of what research day would look like. So all the different posters laid out, all the different groups there. So you're talking about your research, you're collaborating with other people. I remember during one of the years, one of the groups, they were talking about their project with someone, and then one of the sites was like, hey, why don't you come do this at my site? So lots of connections and lots of definitely showing your work. And I think we are right at 15 minutes. So any questions?
Hi, I got a question. Hey, go ahead.
Yeah, go ahead.
I just wanted to know, so in order to do research, does one have to have previous research experience, or could they be trained in doing research at the osteopathic medical school there?